The Limpopo Health Department says there's been an increase in the number of reported malaria cases in the Mopani area. The district borders the Kruger National Park and Mozambique. For more on this, we're joined on the line by Limpopo Health Department spokesperson Macks Lesufi. Mr. Lesufi, a very good morning to you and thanks for joining us. How serious is the situation?
The situation is very worrisome because we have over 233 cases that have been reported in the past 2 days. And we have 62 patients who have been admitted in Malaria Hospital. And 2 of those were severe cases, but the other 60 are now in a stable condition.
Have you had any reports of deaths, Mr. Lesufi?
Any what?
Reports of deaths.
No, there hasn't been any reported death cases so far. But we are monitoring those patients which are in the hospital, and our clinical team will be giving us an update in terms of how they progress.
Which areas of Limpopo have been hardest hit?
The hardest hit areas is Palavora, where you have 32 cases, and the Diane area, which is 111 cases. This is one of the first highest figure we've ever experienced in a short space of 2 weeks, where you have over 200 people who are affected by malaria.
Now, have authorities enforced a travel ban in terms of trying to contain the situation and get less people affected?
We have a team that works out throughout the year, which is led by one of our team members, Philip Kruger. And the teams are now going back to revisit households to continue the spraying. But one of the challenges that we are facing is some of the households don't give us an access. And we want to appeal to those households to give us access, because that will also help us with our preventative measures. Make sure that we spray their houses, we control the spread of malaria in the area. But we also want to send a caution to those who will be visiting the Kruger National Park. Given that this is a school vacation, parents might want to take their kids or whoever to visit the park. Please take the necessary precautions, use mosquito repellents, avoid walking around night in short sleeves. If you want to stay outside to enjoy the weather, try and cover yourself as much as possible, but also use the repellents to be protected.
Mr. Lesufi, is the department confident that it has the situation under control?
No, we are confident. Because I should indicate that it's not the first time that we experience malaria cases. Malaria is one of the killer diseases in Africa, and we know that the World Health Organization has prioritized the fight against malaria as one of the programs that countries in Africa should actually make sure that they intensify their programs. We are doing the same as South Africa, and we're confident that we're putting the situation under control.
Mr. Lesufi, thank you so much for your time this morning. That was Limpopo Health Department spokesperson Macks Lesufi on the malaria outbreak in Limpopo.
Know more about your world.
enca.com